Okay, and there's just still a few people coming in.
Like an exam prep thing.
But it is 6, so we'll get started. If I can just get everyone who's not on mute, just to mute for now. This is a very casual session, so if you have any questions, just interrupt me at any point. That's completely fine. I'm just going to share my screen now. Okay, so welcome to the exam briefing webinar. Before we get started, I just want to acknowledge the traditional custodians of the land on which I'm on right now, which is Gadigal land of the Eora Nation, and I work on Wangal land, and acknowledge their connection to land, sea and community, and pay their respects to elders past, present and emerging. So before we get into the breakdown of the exam, does anybody have any questions about the exam or about content or anything like that? I am just going to remove this because that is not accurate. But apart from that, any questions? We'll go through some of the content on Moodle together, but just if anyone's written down any questions that they have. No. Okay, so the exam is 40% of your total grade. So your total grade is based on some of the quizzes that you've done, your essay, your forums. So this is kind of the biggest chunk. It's a 2-hour exam. So it is an open book exam, but my advice would be you still need to know your stuff, or you need to at least know where to find specific information, because although it's 2 hours and it's open book, there is a lot of content, and I'll go through the format of the exam with you in just a moment. You have a 48-hour window to sit the exam. So the exam is made available, I believe, on the 1st and 2nd, but when we get onto Moodle in a second, we'll confirm that. It's on your course schedule, which you got at the very beginning of the course. So it's open for a 48-hour window from midnight that whole day, and then the next day until midnight. So you have exactly 48 hours to complete the exam. It's open for that time, but once you click begin, then you must complete the exam in that 2-hour period. So you can't do a little bit and then close it and then come back and do a little bit more. So once you click begin, it needs to begin, and you need to sit it all in that 2-hour window. So make sure that you're free and you're available, and you've got 2 hours where you don't have to rush off to work. There's no kids around. There's not going to be any interruptions. If in that time you do have any technical difficulties, so if your internet drops out, or if something happens, then we do require you to provide evidence of that. So whether that's a screenshot or some sort of evidence of whatever incident has happened. So it's a completely online exam, and it's open book, like I said. The pass mark is 50%. I would say read the instructions. So what I mean by that is, if the question is asking you something and it's a total of 3 marks that you can get for that question, just put down 3 points and then move on to the next question. So don't waste your time writing down lots and lots of points, because we can only award you a maximum of whatever. So if there's a question that says list 3 advantages of Larks, just list 3, because if you list any more than 3, we can't give you any more marks than whatever the question is allocated. So that's what I would say in terms of saving your time, and make sure you read the question very carefully as well. There will be a mock exam made available for you today. It should be made available today. If it's not made available today, it should be by midnight, I believe. Basically, the mock exam gives you a little bit of an idea of the level of difficulty of the question, the style of the question in terms of how they're written, as well as the format of the exam. So the mock exam is in the same format as the actual exam, but it's a lot shorter, obviously. You get to have a look at all of the little features that are on Moodle that you will also see in the exam, just so you're not seeing them for the very first time when you do the exam. The mock examination is not marked and it's optional. You don't have to do the mock exam. It's just there if you would like to do it. Any questions so far? Okay. So there's an assessment declaration, which I think you guys would have already done. So the exam needs to be all your own work, so you can't work on it together. It does need to all be your work. Okay, this is a format of the exam. So this is what the exam will look like. Basically, section 1 is made up of 17 questions, and all of these questions are multiple choice. So this is probably, the sections start off easy and then they get a little bit more difficult as the exam goes on. So section 1's pretty straightforward. You might get some questions on just very, very basic sexual health. You might get some questions on sexual and reproductive health history taking. Might get a question on the pill, something simple. So in section 1, it'll just be straightforward multiple choice questions where you're selecting one correct answer. Section 2 also has multiple choice questions. It's made up of 20 multiple choice questions. And in section 2, the multiple choice questions have more than one correct answer. So it'll say something like, it'll have a question and it'll say, select all that apply. So there might be 2 correct or 3 correct or even 4 correct. But basically section 2, there's potentially more than one correct answer. And the sections will clearly tell you, okay, you've started section 2 now. In this section, more than one answer is correct. Section 3 is made up of 5 case studies. So there's 5 short case studies in section 3. What you'll have is you'll have your case study, and under the case study, you'll have a series of questions. And those questions are all multiple choice questions. Some of those questions are single answer multiple choice questions, and some of those multiple choice questions have multiple correct answers. Again, the question will tell you if this is a single correct multiple choice question or a multiple choice question where there's multiple correct answers. So you will know when you go to answer them. But basically you'll have 5 short case studies and then a series of questions underneath it. Then you'll go on to the next page, and then you'll have a fresh case study on the next page with the series of questions underneath it. So you'll have a new page for each case study. There's 5 of them, and that's what makes up section 3 of the exam. Section 4 of the exam is made up of 3 case studies, and those 3 case studies contain short answer questions. So again, this is where the question might ask you to name 3 symptoms of menopause, for example. And so just list 3 symptoms. Don't spend too much time listing, all of the symptoms you know, because you want to just hit that 3 mark, because that's as much as you can get for that question, and then move on. Yep, so they're worth 6 marks per short answer question. So there might be one question saying list 3 of blah blah, so that's already 3 marks, and then there might be another question saying list 1 reason for XYZ, so that's another mark there. So they're pretty short case studies, but yeah, that's my advice. Don't write more than you need to, but just make sure that you're answering the question exactly. Does that all make sense? Yeah, is there anything that you feel like you need clarification on here? For the sake of time, I would suggest not spending longer than 1 minute per question. So don't spend any longer than 17 minutes on section 1. Don't spend any longer than 20 minutes on section 2. So that's a good way for you to keep track of how you're going, to make sure that you're not running out of time towards the end, because we do always have a couple of people who will run out of time. So a good way to keep track of the time is, maybe if you're starting this exam at 12 noon, is just keep track of, okay, 17 minutes past 12, I need to just move on to section 2. Because you want to get through as much of it as you can, really. And if you feel like you might struggle, I think the logical way to go through the exam, I think, is from the top to the bottom, section 1, 2, 3, then 4, because it starts off easy and then it gets a little bit more tricky as the exam goes on. But if you're very worried about time, you can start at question 4, where there's the short answers, and section 3, where it's a little bit more involved, so that at the end you're just doing the easier things. Just go with whatever works for you. Personally, I would start at the top, start easy, and then work my way down, but just be really mindful of the time. So make sure that at the 17-minute mark, you're moving on from section 1, even if it's not finished. And what you can do is you can flag the question. So if there's a question that you got and you're not really sure about it, but you had a guess and you want to come back to it, there is a little function where you can click a little flag, and it will flag that question and highlight that question. So at the end, you can come back to it and read it again and go through the answers again if you want to. I'll see. So this is what it looks like. So do you see this little flag just here? Yep. So
Yes.
basically, this is what the question will look like. And if you're not really sure, you just click on the flag. The flag will go red and it will pop up on the bottom. So there it is. So this is what your at the bottom of your screen, or at the side of your screen, depending on which web browser you're using, or how big your screen is, or how big your window's open. This will either come at the bottom of your page or on the right side of your page. And this is basically an orientation to all of the questions. So you can see question 1 to 5 have been cut off here, but you can see here that question 38's got a little red corner, because question 38 has been flagged. And so later on, once you've done the question, you can come back to it.
Perfect.
So you can, so you can clearly see which one you want to have a look at again. These grey boxes mean that you've already attempted that question. And when there's no grey box, when it's just plain white like this, that means that you haven't answered that question yet. These boxes with the letter I in them, these that just means that that's an instruction section. So either it's got the case study in there or it's got instructions. So for example, it'll say, this is section 1. This is a multiple choice section where you select one correct answer. So the I's aren't actually questions. They're just information blocks. So those blocks here, when you look at the end, they will remain just plain white. So it'll look like you haven't answered a question, but if there's an I, it's just info. So does that all make sense? And this part here obviously is how much marks the question's out of.
Annam, do you mind if I just asked a question about the section for the short answers? We're typing into the box, and so is it okay just to type a sentence or even just one word if that answers the question?
Yeah, dot points are fine. Yeah, dot points. Okay. Like if it says, list. So sometimes you'll find it might say list 3 reasons, or list 3 risk factors of STIs, and then explain why this is a risk factor. So in that case, I would say it's 1 mark for each risk factor and explanation.
Sure. Yep. Yeah. And so just a sentence is okay just for the risk to why is this a risk factor?
Yeah. So we'll read it, whatever format you put it in, whether you put it in a sentence or a dot point or a paragraph, as long as the information's there somewhere, we're pretty relaxed about how you put it in there. It's whatever you feel like works for you, as long as you feel like you've met the question.
Perfect. Thank you.
Yeah. So, but from memory, like the questions won't require you to write like a paragraph or anything like that. I think dot points will be fine.
Perfect. Thank you.
To answer those questions. Yeah, they're not very long questions. Those section 4 case studies are quite short. I'd say the section 3 case studies are more extensive and longer, but they're multiple choice.
Yes. Okay. Yep.
So again, some of them are single correct, some of them are multiple correct, and the question will tell you which is which. And this is another indicator to tell you which is which. So when you see around, this is one form of multiple choice question you'll see where there's A, B, C, D, so all your options, and it comes with a round dot. That's when you can only select one correct answer. But when there's a checkbox with the ticks, that's when you can select one or more. So you can select as many as you want.
Yep.
So that's another way to tell if it's a one correct or a multiple correct answer, multiple choice.
And I'm sorry because I dialed in late, and I apologise
to
anyone who's already heard this. So it's open for a couple of days. The exam?
Yes, so it's open for 48 hours. The exact dates are on your course schedule, but it's early November. It's open for exactly 48 hours between the 1st and the 2nd. So that means like from midnight until midnight, 48 hours later.
Perfect.
So you can sit it at any time during that 48-hour period, but once you've clicked begin, then you do need to sit it in 1 2-hour period. So just make sure that you've got a 2-hour period where you're, in a quiet room and you can concentrate and you haven't got any other distractions. We do understand that sometimes there can be technical issues, internet might disconnect or something could happen. In that case, we just need some evidence. So like a screenshot or any kind of evidence of whatever the incident was. Just let us know as soon as possible. And what else might you have missed out on? It's an open book exam, but I was just explaining that there are a lot of questions. So in order to make sure that you can meet all of those questions and answer them all, I would recommend studying. I would recommend knowing your content and then if anything, if there's a topic you find tricky, just making sure you know where exactly you can find your information, like where your notes are on that particular section, because the 2 hours does go really quickly, and it would be a shame to miss out on answering questions.
Yep. Thank you.
So I would recommend everyone to come back, have a look at this slide, and just work out how you're going to answer the question. Don't spend any longer than a minute per question, just as a very rough guide. So if you've spent 17 minutes on section 1 and you're not finished, just move on, flag the questions you haven't done, and come back to them if you have time at the end, just to make sure you're getting through all the sections at least a little bit. But yeah, I would just recommend staying on top of the time so you do get as much of it done as you can.
Perfect.
Yeah, because it's not just about the marks, it's a really good learning opportunity as well. It covers everything you've done in the course. So it's an opportunity for you to learn too. Any other questions? Okay, so yeah, like I said, know where to access your information. As a very rough guide, a minute per mark, attempt every single question. Just try your best to literally get to every question is all I can say. Like, really watch the time, make sure that you're not spending too long on one question. If you're finding it difficult, flag it with that little flag function, and then come back to it if you have time at the end. It's better for you to just get through the questions where you're confident with the answer. And like I said before, look at the marks allocated to a question, which only really applies to the short answer section. So if there is a question that's only worth 3 marks, don't spend too long writing about it, because we can only allocate the amount of marks that is allocated to that question. So revision, we'll go through some content revision. These are all of the topics that you could get assessed on. These are just all the topics that are in the RASHCAP course. We'll start from the top. Cervical screening. Anybody have any questions about cervical screening? Anything that they're not particularly sure on? I'll get the Moodle up. So do you understand the difference between an LBC and a HPV test? Maybe that's one to look up.
Would they ask a specific pathway question, Anam?
No. So anything, no. We don't, because in the clinic, you're not expected to memorize those pathways.
Yep.
Just very basic, the general basic information we want to know, if someone comes back positive for HPV 16, 18, that's, a red flag. We want you to know that anyone with intermenstrual bleeding or postcoital bleeding is a red flag. They need to be reviewed by a doctor. They need further investigations. We just want you to understand the general concepts. But you don't need to memorize those pathways at all. But if you do need them for a question, this is what I mean about knowing where your resources are, knowing where to find things in your notes. So you should be able to quickly access these things if you need them in an exam setting. So I know like some people do sort of relax a little bit when they hear that it's an open book exam, but sometimes they can be a little bit more difficult because you're expected to know more. It is, but you won't be expected to, like memorize treatments for, mycoplasma or anything like that. But understanding the general principle, like, knowing the basic treatment for chlamydia or knowing the basic treatment for gonorrhea, understanding about contact tracing and why we contact trace, and understanding what partner delivered therapy is, and how should we screen someone who's under 30, and those sorts of things you should know, but you don't need to know exactly what antibiotic dose and treatment you need to give someone for syphilis, for example. You don't need to, because that's a little bit out of the scope of a nurse, but just understanding, that you would use an antibiotic for something like chlamydia and you'd use an antiviral for something like herpes. So just general concepts, but you won't be expected to memorize any guidelines or anything like that. It's more just about like applying the guidelines. So understanding why we contact trace and that sort of thing. But like I would still have all these resources at hand because you may need them in the exam. Like I said, you're not expected to memorize like cervical screening pathways or anything like that. Because when you're in the clinic, like you're allowed to look at your pathways, you're allowed to use your pathways and refer to them, when you get a result or when you're trying to work out what to write on the pathology form. So you're not expected to memorize it in an exam setting.
Perfect.
So from Tuesday midnight, so as soon as it has clicked over to the 1st of November, you will have access to the exam, and you'll have access to the exam all the way to the very end of the day on Wednesday, the 2nd of November. So that's a full 48-hour period. I'll just share my screen. So you have that full 48-hour period to sit the exam. Just be mindful, by the end of this week, you need to have completed all of your quizzes. And the quizzes will really help you to prepare for the exam as well. So, yes.
Jumping ahead, Anam, how long would you anticipate it would take for you to mark our exams?
So the first 3 sections of the exam are multiple choice, and they're marked by Moodle. So the system marks those. I would just need to go in and mark section 4, which is the short answer sections, because the system can't mark. It can, but because some people write with typos and stuff, which is okay. You're not going to lose marks if you've made a typo, but the system doesn't pick it up. So I've got to manually mark section 4. So I'd say maybe like a week or so.
And so what about issuing of certificates? And I'm sorry, I know it's jumping right ahead.
No, that's okay. So basically, I don't produce the certificates. So the certificates are done by a different team. So what will happen is, once I've marked the exams, I'd say that marking the exams, I would give it 2 weeks, because I'm training a couple of people in the marking process as well. So once the exams are marked, I give the final results. I have to tally up all your final results from every single quiz that you've done. And there's a couple of manual amendments that need to be made for a couple of the quizzes, where we need to fix people's results. So we'll do all of that, add up all your marks, and then hopefully, if you've finished all the components, you should get your certificate soon.
Perfect. Thank you.
Yeah. So there's a little bit of sort of admin work that needs to be done behind the scenes, but hopefully it won't be too long.
Yep. No, that's fine. Thank you.
Any questions? Any other questions? Another general tip. Oh yeah, sorry, go for it.
We just have access, is it to the therapeutic guidelines for 12 months or is it to the handbook for 12 months?
The handbook.
Handbook, yep.
Handbook, yeah. What I was saying just before I forget, in terms of studying, use as a guide, use the intensity of the topics that were covered as a guide to how much you need to study for them. So, for example, caring for trans and gender diverse individuals was only covered in one pre-recorded lecture. So it will definitely be covered in the exam, but it won't be covered as heavily as a topic like oral contraception or STIs or LARCs or, sexuality and disability. Will be covered more heavily than, for example, anatomy and physiology. Just because they were covered in a lot more components of the course.
Yeah.
Aaron, I still kind of access the handbook there. We've got IT involved, everyone involved. It's not happening.
So Danella, yes, I did. I received an email about that. Have you registered? I think.
Yeah, I've done everything, and then I was able to access it one day, and then I went in to do it over the weekend, and it denied me access again. And then you put your email address in, it says it doesn't recognize it. So, and then you try again, it says this one's already registered, you can't redo it. I've had, and they're still looking into it, but there's so much information there that I can't access. So I think I'm just have to buy and then suck it up, I guess, because it's getting pretty damn close.
Yeah, no, look, Danella, look, I've emailed the person from the research team that looks after that, because unfortunately I don't have any control of it. I have sent them an email. So we will wait to see what they come up with. But how about we have a chat about it at the end?
Yep, sure.
Is that if you just stay on for a little bit longer, if that's okay, and we'll have a chat about it.
Yep, not a problem.
Yep. Has everybody else got access to the textbook at the moment?
Yeah.
Okay, cool. So so just looking through the topics. Okay, cervical screening, you will need to know in quite a bit of depth because it's covered quite a lot in the course. There's quite a bit on it. There's 3 hours on this Moodle section that is covered over in cervical screening. So you will need to know quite a bit of cervical screening. But like I said, just the principles. You don't need to memorize any pathways. We did a lot of work on cervical screening already in terms of we did those case studies. Remember in the very first webinar, we did the case studies on cervical screening. So there won't be anything examined that intensely in the exam. It'll be more, knowing your equipment, which brushes to use, when to not use certain equipment, and just general principles in terms of how to make someone feel more comfortable when they're having a cervical screen. For example, someone with vaginal atrophy, techniques you can use and that sort of thing. So you don't need to memorize any pathways, but have those open and available while you're doing the exam, because cervical screening will still be covered to some degree. History taking is, again, it's a topic that was covered quite heavily in the course. There was a big lecture on it, again, in our first webinar, and an activity on it. So again, what I would really emphasize in terms of history taking is the questions that you need to ask and the rationales behind the questions, which you kind of covered already in your history taking assessment, but just understanding why you're asking each question. So for example, why do you need to take a travel history when you're looking at someone with a potential STI, or why are you asking them about vaccinations? Or why are you asking them about the type of sex you're having? So think about rationales. STIs, again, have the guidelines readily available, but like I said, you're not expected to know it, mainly in terms of treatment. Know the class of medication that's used, but you don't need to know the exact dosing of azithromycin or the exact dosing of doxycycline or anything like that for the exam, but you do need to know the general principles in terms of what screening you need to do, whether you do a culture and sensitivity or you're doing a PCR swab, the different screening that you need to do for different populations. So what screen would you do on, say, someone who's heterosexual and under 30 versus someone who's a man who has sex with men? So just knowing your different populations and the tests to offer, and then also how are those tests taken? So how do you test for syphilis and how do you test for chlamydia? Oral contraception, again, you don't need to know every single contraceptive pill and the dosing of that. We just want to look at general principles. You need to know, again, you don't need to memorize the MEC criteria, but you do need to know just the big things in terms of the MEC criteria, like what are the big MEC for contraindications, just the very important basic stuff like VTE, someone over 30 who smokes more than 15 a day, just all of the basic red flags when it comes to prescription of the contraceptive pill, but you don't need to memorize all of the MEC criteria by any means. LARC is the same. Just know about the risks and the contraindications. You don't need to know the exact dose of the Mirena versus the Kyleena, but do go through the difference between the Mirena and the Kyleena. That's important to know. Pregnancy options, so know what the options are in Australia, what's legal, know about the risks and the side effects and all of that sort of thing. Men's health, so men's health isn't covered too heavily in the exam because it's not covered too heavily in the course. So for men's health, I would recommend going through the chapter in the textbook as well as looking through this module here. Sexuality and disability, that's sexuality and disabilities and minors violence in the law. They're really important topics. So I would really emphasize looking through the ERASH handbook as well as looking through the lectures that are up here. And again, caring for trans and gender diverse populations, you want to know general principles. So you want to know about how to safely screen these people, how to what kind of sexual health needs they have, and all about pronouns and how to use them and why they're so important. Domestic violence, you again, it's just general principles. You don't need to know about what exact questions you need for screening, and you don't need to memorize them or anything like that, but just, things to look out for. So anatomy and physiology, like I said, just have a look at how heavily it's covered in the course and in the ERASH handbook. Screening is really important. So we've covered that already. Look at the different populations, know what tests to do. Contraception we've covered. Menopause, again, you need to know the side effects of the effects that menopause can have on people, some of the treatment options. You don't need to go into the exact dosing and the exact prescriptions that someone needs, but just know what treatment is available out there, what sort of symptoms people suffer with, and how they can be managed medically, but also from a nursing point of view. Common gynae issues is talking about thrush, bacterial vaginosis, trichomoniasis, and then looking at, I'm not sure if I think there are a couple of skin conditions as well that are covered in this topic, like lichen planus and lichen sclerosus. So again, just knowing how to identify them. Breast awareness, know what breast screening is available in Australia and what breast awareness is, and sexual assault. So just, again, general principles. It's not covered too heavily in the course, so it won't be in the exam either. And then there's a couple of extra resources here. So preparing for the exam is now open. These are the answers. So if you want to have a go at attempting the exam, just do that first before you have a look at the answers, I'd say, to test yourself. It's a good way to test where your knowledge is at, because like I said, the mock exam not only goes through the format of the exam and the different styles of questions, and it breaks it down into all the sections, but it also is sort of the similar level of difficulty as the exam. So it's a good way to gauge where you're at. And you can do that as many times as you like. It doesn't close or anything. Yep. Any questions about anything? No?
No, thanks.
All right. Not a problem. Well, thank you for attending. We will pause our record. We'll stop our recording now.